This is BC568, and it's by the same company, Tanita, as the last BIA scale. So we're going to do a very similar procedure when setting up the scale. So you're going to press and hold the down button for 3 seconds in order to program the current date. So you want to make sure it's 2019, that it's September, and it is whatever day of the month it happens to be. So if that wasn't correct, you would use the upward and downward keys, and then you'd press set. We don't necessarily need to know the time of day, and then you know that you've programmed it correctly once this date appears properly on the screen. So next up, we are going to program the individual data. So we want to press the set button, and you choose 1, 2, 3, or 4. So you press set, and then you want to use the upward and downward arrows to program your year of birth, your month of birth, and your day of birth. You then have to choose between female, male active, female active, and male, and then press set. And then you have to increase or decrease using the upward and downward keys to get your actual height, and press set. When it says clear, no, you actually want to press the upward button and click yes, set. It says cleared, but the data actually isn't cleared. It's set. So once the screen goes dormant again, you can click on the number 1 button at the bottom, which you just set, and it should have all of your data remaining there, ready to step on the scale. Okay, so once you've programmed your data, the scale is going to be placed on the floor, and this scale will actually show you pictures as to what you're supposed to do. So you're going to start by clicking on the number 1 if that's what you programmed. It's going to have all of your data programmed into it, and then it's going to show you to step on the electrodes and to grip the hand pieces to pull up, and then just hold them while it takes your measurements. It's going to show the progress on the body. Right now it's going down the left arm, then the right arm, then the left leg, and the right leg. If you're not getting conductance, you might have to wet the soles of your feet, and once the human is lit up on the scale, it is ready to display your data. So you can step off. So first off, you want to get your total body weight. So you're going to press the scale icon, 183.2. You next want to get your body fat percentage, so that's the little human with the body fat. If you keep pressing on it, it will give you right arm, left leg, right leg, trunk, and your total body fat percentage. We then want to get your total muscle mass, little human holding weights, and if you keep pressing on that, once again, it will show you right arm, left leg, right leg, your trunk, and your total muscle mass. Now, those numbers that are at the top, 1 through 9, it's giving a 5. That is actually your physique rating. I'm going to tell you to take this with a grain of salt because the pictures are totally unforgiving that come with this particular scale. And keep in mind, the point of this is to learn how to use different scales, not to take everything that is stated on the scales. If the system times out while you're trying to take your recordings, you simply press the middle button at the bottom, and you press the number 1 if you were set as number 1, and if you press graph, it will allow you to go back to the data. So there we see your total mass, your body water percentage, so it's the little icon in the middle, gives total body water. We also want to look at bone mass, so it's the skeletal picture that's located there. Next up is visceral fat. And then lastly is DCI or BMR. It will also flash your metabolic age. So a lot of you are going to find that your metabolic age is way off. Usually when I measure mine, it is 12, so not the most accurate. Prior to using any BIA, you should follow the pretest guidelines. For example, no eating, drinking, or exercising for at least 2 hours prior, yet preferably 6 hours if you can. You should wear the same lightweight clothing, and you should complete tests and retests at the same time of day and month if possible under the same room conditions. Everything that you can do to ensure standardization will improve the accuracy of your results.